You know, it's something we all hope for, but maybe don't think about too deeply until we actually need it. How do we really know if the healthcare we're getting, or, maybe our family members are getting, is genuinely high quality and safe? It's such a basic question, really.
It is, yeah. And thankfully, there are actually systems designed to give us that assurance.
Yeah.
So today, we're doing a deep dive into healthcare accreditation. It's a really crucial way to make sure standards are being met and kept up.
Exactly. And to make this really concrete for you, we're focusing on two key organizations driving this based on the info we looked at.
Right.
Joint Commission International, JCI, which is global, and then the National Accreditation Board for Hospitals and Healthcare Providers, NABH. That one's setting the standard in India.
Yeah, and our goal here really is just to clarify what these bodies actually do,
Yeah.
Why their work is so vital for quality and safety in healthcare, and what are the main takeaways for anyone seeking care or even working in the field?
It's pretty amazing when you think about JCI's reach. Active in, over 70 countries?
That's right.
Accredited over 1,000 programs. That just gives you a sense of the scale, their influence on international health standards.
Huge influence. And then if we zoom in on India, NABH, which is part of the Quality Council of India, well, it was set up specifically to create and uphold those quality and safety standards within India itself.
Okay.
And while getting accredited is voluntary, more and more places are doing it. They see the value.
Right. They're recognizing it's worth the effort. We even saw this organization, Supreme Medical Consultancy. They actually help hospitals get through the NABH process.
Yeah, which tells you something. It underscores that meeting these benchmarks takes real dedication. It's not just ticking boxes.
Definitely not. Okay, so let's unpack this a bit more. To start, what exactly are JCI and NABH at their core? What's their main function?
Well, Joint Commission International, JCI, their mission is really clear: to enable and affirm the highest standards of healthcare quality and patient safety for all. Simple as that. Okay. And they've been seen as a leader, internationally in this for over 20 years now.
Wow, okay.
What's really interesting is how they develop these super rigorous international standards, things that directly tackle quality and patient safety. And a key part of that is their international patient safety goals. Yeah, they target specific kind of high-risk areas in patient care. Really practical stuff.
So JCI is really setting that global benchmark. Okay, so how does NABH then approach this, but within the Indian context?
NABH's main job is to set up and run accreditation programs just for healthcare organizations in India.
Right.
And they use a really thorough evaluation. I mean, they look at everything from the direct clinical care patients get to how safe and well-maintained the hospital building is, even the admin processes behind the scenes.
Comprehensive.
Very. The goal is making sure these places stick to high safety standards and ethical practices.
That sounds like a really complete review. And NABH, it sort of operates independently, even though it's under this Quality Council of India umbrella. Is that right?
Exactly. Yeah, they get support from, the industry, consumer groups, the government, but they're set up to have full functional autonomy. They make their own operational decisions.
Got it.
And another important thing is their international links. NABH is an institutional member of ISQA. That's the International Society for Quality in Healthcare. And they were actually a founding member of ISQA, the Asian equivalent.
Oh, interesting.
Yeah, it really shows they're serious about aligning with, global best practices in quality and safety. They're not just looking inward.
Okay, so we've got a clear picture of what these organizations actually are. But let's get to the why. Why should a hospital bother? Or ultimately, why should someone needing care see JCI or NABH accreditation as a big deal? What are the actual real-world benefits?
Okay, good question. Let's take JCI first.
Yeah.
They talk about the JCI advantage. And with their long history focused purely on healthcare quality, they just bring this huge amount of expertise. Their aim is to help organizations get to what they call highly reliable care delivery.
Highly reliable care.
Yeah, along with building a strong culture of patient safety. And they don't just set standards. They provide expert resources and practical tools to actually help organizations get there.
Right. And we saw some feedback, didn't we, from hospitals that actually went through the JCI process? What kinds of things stood out to them?
Yeah, the testimonials were quite revealing. For example, Hong Kong Adventist Hospital said the process really pushed better teamwork, coordination, communication across all their different departments.
Breaking down silos.
Exactly. And that kind of improved internal working, you can see how that directly leads to fewer mistakes, a smoother patient journey.
Makes sense.
Other places, like Burjil Farha Hospital, They really emphasized the competitive edge they got from JCI accreditation.
Right.
Plus, more trust from the community, better risk management, and really embedding this culture focused on keeping patients safe. Emirates Specialty Hospital mentioned the extra credibility, the JCI Gold Seal. Patients see that and feel more confident.
Yeah, that seal means something.
It does. And Corniche Hospital, they talked about it demonstrating their ongoing commitment to excellence, meeting those high international standards, especially since they've been accredited multiple times.
So these aren't just small tweaks. We're talking real, tangible improvements in how hospitals work and how people see them. Okay, let's switch to NABH in India. What are the key reasons their accreditation matters for hospitals there?
Well, the QI playbook source we looked at laid it out pretty clearly. First, and maybe most importantly, it's about enhancing patient safety and care. Simple as that. Meeting NABH standards means hospitals are just better prepared to handle critical situations safely.
Okay, fundamental.
Absolutely. Second, there's a big boost in operational efficiency. The structured processes NABH requires. They help hospitals streamline how they work, cut down on waste and inefficiency.
Right, makes things run smoother, like maybe shorter wait times, better use of resources.
Exactly that sort of thing. Clear protocols mean less confusion, better flow.
Okay, those are two big ones. What else did the playbook highlight?
Well, accreditation also really works to boost credibility and trust. For you, as a patient, seeing that NABH accreditation is like a signpost, saying, this place has met tough quality standards, that builds confidence.
Yeah, I could see that.
And then from a business angle, it gives them a real competitive advantage, helps accredited hospitals stand out from the crowd, maybe attract more patients. And finally, getting NABH accreditation helps hospitals line up with both national and international standards. It could even be like a first step if they eventually want to go for something like JCI accreditation down the road.
Okay, that makes sense. The QI playbook also had those insights from Dr. Rakesh Kumar at Medcare Hospital about their journey getting NABH accredited. What were his main points?
Yeah, that was interesting. Dr. Kumar really stressed that for them, getting NABH wasn't just about the certificate on the wall.
Right.
It was fundamentally about lifting the quality of care they gave and making sure their practices matched up with global best practices. He talked about their initial gap analysis, where they figured out the difference between what they were doing and what NABH required.
Crucial step.
Absolutely. That showed them exactly where they needed to improve. Then they really focused hard on improving patient safety stuff, getting their documentation much better, investing in training their staff.
So real groundwork.
Yeah. And the result, he said, was better communication between staff, fewer medical errors, and just a more efficient workflow across the whole hospital.
Sounds like it really transformed things. Did he mention any big hurdles or challenges along the way?
He did, yeah. He said a key challenge was making sure all the departments stayed aligned with the NABH standards continuously. It wasn't a one-time push.
Maintaining it.
Exactly. It takes ongoing commitment from everyone. And keeping that high level of quality consistent, even after they got the certificate, was also a big undertaking, but one they felt was ultimately really worth it.
That really drives home the point, doesn't it? Accreditation isn't just an endpoint. It's a commitment to keep getting better.
Precisely. An ongoing journey.
Okay, so we've covered what JCI and NABH are and why getting accredited by them is so important. Let's dig into the specifics now. What do they actually focus on? What are the key standards, the main areas they look at?
Right. For JCI, their standards really form the bedrock of their whole evaluation process.
Okay.
These standards are carefully designed to help healthcare organizations not just, meet a bar, but to continuously measure how they're doing, assess it, and improve performance across a whole range of functions.
Constantly improving.
That's the idea. And like we mentioned before, their international patient safety goals are absolutely central. They really zero in on those high-risk areas that can have the biggest impact on whether patients have good outcomes or not.
Got it. And for NABH, thinking back to the QI playbook, what were some of their main areas of focus for accrediting a hospital in India?
NABH puts a lot of weight on several key areas. Things like patient rights and education, making sure patients know what's going on with their care and that their rights are always respected.
Essential.
Totally. Then there's patient safety and infection control. This covers really critical stuff like proper hand washing, strong systems for managing medications to avoid errors, and practical steps to stop patients from falling.
Okay, very practical safety measures.
Very. They also look closely at hospital management and leadership. Is the leadership actively involved in managing quality? Are they accountable?
Right, leadership buy-in.
Crucial. Then facility management and safety. Is the building itself safe and clean? Is equipment maintained? Are they ready for fires or other disasters?
The physical environment, yeah.
Exactly. And finally, quality improvement processes. NABH expects hospitals to have systems for doing internal audits, using clinical pathways for best practices, and actually listening to and using patient feedback to get better.
Wow, okay. It's really striking how similar the core focus areas are for both JCI and NABH, even though one's global and one's primarily in India.
It is, isn't it?
It really highlights that there are these universal principles of what good, safe healthcare actually looks like.
Absolutely. It boils down to some fundamental things.
Yeah.
And, to connect this to the even bigger picture of healthcare quality worldwide, we should probably mention ISQA.
ISQA. Okay, what's their role?
That's the International Society for Quality in Healthcare. Think of them as a global organization whose whole mission is promoting quality improvement in healthcare everywhere. And both JCI and NABH have strong connections with ISQA.
Ah, okay. How do those connections work?
Well, for starters, NABH is an institutional member of ISQA. That signals that they're aligned with international best practices and committed to those global quality standards.
Great part of the club.
Sort of, yeah. More broadly, ISQA does a lot to improve healthcare quality globally. They provide education and training. They help share knowledge and best practices across different countries. They even offer evaluation and accreditation services themselves, sometimes accrediting the accreditors, like JCI or NABH standards.
No, interesting. Meta-accreditation.
Kind of. They also support health systems trying to build quality in and connect professionals who work in this field. You could almost see ISQA as like a central hub, pushing healthcare quality forward on a worldwide scale.
So it really is all connected, a global push to raise the standards for healthcare quality and patient safety.
Exactly. And for you, listening, understanding these different bodies, JCI, NABH, ISQA, it gives you a really useful way to think about and evaluate healthcare quality, wherever you might be.
Right.
It provides a kind of framework, helps you understand what to look for, what level of commitment signifies, a real dedication to providing top-notch care.
Okay, so as we start to wrap up this deep dive then, what are the absolute key things you think we should take away from our conversation about JCI and NABH?
Well, I think the main message is that both JCI and NABH are really vital organizations. They're actively working to lift the bar for healthcare quality and patient safety. They do this by setting tough standards and having these thorough accreditation processes.
Right. And it's definitely more than just getting a certificate to hang on the wall, isn't it? It seems to represent something much deeper.
Oh, absolutely.
Yeah.
Accreditation is a huge commitment. It really signals that an organization is dedicated on an ongoing basis to a culture of always trying to improve.
Mm-hmm.
And it's about building that solid foundation of trust with their patients and with the whole community they serve. It's really a continuous journey towards being excellent in healthcare.
That's a great way to put it, the ongoing journey, not just, crossing a finish line. So as we finish up, here's maybe a final thought for you, the listener, to chew on. Beyond these formal accreditation processes we've talked about, what other ways, maybe more innovative ways, could healthcare systems use to make sure quality and safety keep improving? And also, what's our role? What active part can we as patients play in demanding and also recognizing really high-quality care when we see it?
Good questions. Food for thought.
Definitely something to think about. And hey, if you are interested in digging into this more, we'd really recommend checking out the websites for JCI, NABH, and ISQA. There's a ton of great information there.
Yeah, definitely worth a look.